This was a study of 168 patients that was a randomized trial that basically had half of the patients would get Ixazomib and Dexamethasone in the relapsed setting, relapsed refractory setting, and half would get dealer's choice, physician's choice. So any of those the regimens that could be used would be dexamethasone as a single agent. It could be melphalan and dexamethasone. It could be lenalidomide and dexamethasone. It could be cyclophosphamide, dexamethasone, or thalidomide and dexamethasone. And so it basically is a doublet versus a doublet. Patients were well balanced in terms of their baseline characteristics and so forth. The primary endpoint of that study was overall hematologic response. And then secondary endpoints included overall survival as well as hematologic CR rate. The issue with this trial, patients were stratified by cardiac stage and whether they had prior PI exposure. And so what was found in this study was that the first primary endpoint, the hematologic overall response rate, that was not met because the patients with the Ixazomib dex did not get quite as good as a hematologic response rate as was anticipated, and the control arm got a better. So it was 53 versus 51%. That said, the complete response rate was 26% versus 18% with the Ixazomib dex versus the other doublets. In addition, the duration of response, the vital organ response, the progression-free, time to subsequent therapy, all of those things favored Ixazomib and dexamethasone. And so the drug was well tolerated in terms of AEs, especially if you correct it for time on therapy, because patients were on therapy for nearly twice as long as the control arm because patients were doing better. It really was a well tolerated regimen. It's unfortunate in that, quote, it's not a positive study, though there are so many very positive features for the regimen. And kind of in hindsight, if one thinks about it, if we look into the myeloma world, there's really no trial which compares a doublet to a doublet. All of the trials have been a doublet versus a triplet, including a new drug. And so, I don't know that any drug could have been approved for myeloma, with this particular design. So again, this is not going to get FDA approval for this indication per se. But that said, I think it's a highly effective regimen and a very good option for patients.